Good day, everybody. Welcome to Health, Home, and Lifestyle. And joining me now is actually Dr. Annette David, who will be sharing the island's suicide rates as she has new numbers. Doc, how are the new suicide rates numbers looking since September is also Suicide Prevention Month?
That's right. Well, in 2020, we were really dismayed when we saw that significant increase in suicide rates. And what we were hypothesizing was for 2021, since the pandemic was continuing and not going away, our thinking was that the rates would stay high or go even higher. And to our surprise, the rates actually went down. So for 2021, we went from an age-adjusted suicide rate of 30 per 100,000 in 2020, and it went down to 21 per 100,000 in 2021. And what that really means was we went from 40 suicide deaths on the island in 2020 down to 26 in 2021. So that was a significant drop, and it was welcome news, although it did perplex us at the beginning.
Thank you for those numbers, Doc. I guess is there a reason why the numbers dropped, or can this be attributed to possibly the crisis hotline at the time being active?
Yeah, we were thinking about that a bit in the Guam State Epidemiological Outcomes Work Group, and I do want to shout out to the members of that work group and the Guam Behavioral Health and Wellness Center, because it is a group of us that really looks at the data every year. And our thought was that this what seems to be a paradoxic or counterintuitive decrease in 2021 can actually be attributed to three things. One, the outreach on mental health really intensified during the COVID pandemic. And I think the effect of that was to denormalize the stigma with reaching out for mental health issues. So when in the past, perhaps people thought it was not okay to ask for help for mental distress, with all the outreach that we had because of the COVID pandemic and mental health issues, it became easier to reach out. It became okay to reach out and ask for help because of mental distress. So that was the first reason. I think the second reason was what you alluded to, that we also intensified not just the outreach, but the services for mental health promotion and protection during the COVID pandemic. So you'll notice with everything that public health put out about COVID, there was always in there an inclusion of the crisis hotline and resources where people could get help. Also, the Guam Behavioral Health and Wellness Center really expanded the services that they provided by increasing the capacity of the crisis hotline and then transitioning to the special 988 helpline, if you know that recently just came into use. They also created a mobile response unit where if people were in mental distress, they didn't have to worry about how to get to the behavioral health center. The behavioral health team would go to them where they were. And then also, if you recall, there were teams that were sent out by the government with people to help vaccination and treatment of COVID in areas where perhaps people did not have transportation access. And that always included social workers and some mental health professionals too. So this holistic approach where services were made much more accessible and expanded for mental health protection also helped. But I think the most important reason, and it took us some reflection to get to this, Daniel, was that in the end, if you think about it, what is the root cause of suicide, right? And in the past, we used to say, well, the root cause is maybe substance abuse or depression or mental health issues. But that's not really the root cause, because depression and substance use are also symptoms of more fundamental underlying causes. And I think those underlying causes, which we call the social determinants of health, how people live, what's their socioeconomic condition, those were also addressed during the pandemic. I think because of good leadership in our government, people were able to get job security, protection for their jobs, income help for those especially who had to shut down Businesses also had that helpline. We had all of these social protections. And I think what that created was a mental health safety net for people because they felt supported during a time of crisis. And I think what we are seeing are very tangible, positive outcomes from that holistic approach to protecting people's livelihoods and lives.
Thank you, Dr. David. Well, so I guess just to wrap everything up, since our suicide rates have declined a good amount, what do you think should continue to be done to make it go down even further? Should we just keep on doing what we're doing now, or maybe just be a little more aggressive in doing it and, just trying to get these services out there?
Well, I think there are really good lessons to be learned from our experience in the past year. And I think the key lesson there is that it's when people feel helpless and hopeless that suicide becomes a real risk. And so what's important is we provide them with the hope, but we also accompany the hope with the help that they actually need to live their lives with dignity and in a very healthy way. So I think that holistic approach to addressing the social determinants of health, to increase and improve the quality of lives of people, and they may not be directly related to mental health services per se, but they have to do with making sure that people have homes that they're secure in, that they have food to eat, that their jobs are protected, that there's support for them, and there are services in the community that they can tap into when they need help. Ensuring that there is that help together with the hope, I think will really see us into a future where perhaps suicide becomes just a past memory. That certainly is our vision.
Thank you so much, Dr. David. Well, you guys heard it here first. Really great news, suicide rates down. And of course, should anybody, start to feel stuff that they're not supposed to, or they're thinking about taking their own lives, 988 is only one phone call away. And of course, thank you again to Dr. David, who's always a pleasure to interview. We'll see you guys next time on Health and Lifestyle. Don't go anywhere.